All right, it looks like we are live. Hello, everyone. Thank you so much for joining our short little live stream today. My name is Alex Sorotsky. I'm a public health educator with the Washington Poison Center, and it is National Lead Poisoning Prevention Week. So, what better time than to bring some awareness to the Washington State's House Bill 1139? Which passed earlier this year. Now, to help explain the importance of this bill, we've got a phenomenal guest today. We have Kira McCoy joining us. Now, Kira has a master's of public health, is a clinical instructor at the University of Washington School of Public Health, and they are also a legislative aide to Representative Paulette, who sponsored this particular bill. Now, thank you so much for joining today, Kira.
Happy to be here.
All right, so folks, this is a live stream, and if everything is working correctly, we should actually be able to see any comments you post in the stream itself. So go ahead, post any questions you have. We'll do our best to answer them live. In worst case, if we miss them during the stream, we'll catch them after the fact. So Kira, let's dive in. What exactly is this bill?
Yeah, so 1139 was really aimed at reducing the amount of lead that we have in our school drinking water, and also for cooking. When we cook that macaroni and cheese, we use water from the tap, and it's really important that we make sure there's as little lead in there as possible. So this legislation requires that all schools in Washington State be tested for lead in their water by 2026. And so this would be any schools that were built before 2016, because we know schools that were built more recently have newer pipe systems that aren't using parts containing lead. So this is testing. The testing will be of water outlets, including the drinking fountains, bathroom sinks, the food prep sinks, and it will require retesting every 5 years. And so if there's an elevated blood level that's found, then schools have to develop an action plan to be able to plan with the local public health department. How are we going to remediate, or how are we going to address this issue? And so the legislature provided grant money through OSPI, the Office of Superintendent of Public Instruction, in order to cover the costs of the repair. Another important component of this bill was setting the action level at 5 parts per billion. So this is the level at which you have to take action, anything above that. And so this is really exciting that we were able to get it to that level. We know that there's no safe level of lead. The American Academy of Pediatrics recommends 1 part per billion. But this is much better than what we were operating on before, which was 20 parts per billion. So bringing that level down is another huge win for this bill.
Wow, that is a significant difference there. Thank you for walking us through that. So for folks who may be less familiar just with the concept of lead poisoning, why is lead such a concern for youth?
Great question, Alex. So lead is such a concern because it acts as calcium. So when you ingest it, it is stored in the body as calcium and can cause some significant neurological effects, particularly for young children as they're growing and developing. And so we see that even low levels of lead exposure can impair brain development. So it can reduce IQ and emotional reasoning. It can lead to difficulty learning and concentrating, even leading to cardiovascular issues in adulthood. And just to give you an example, so once you ingest lead, it exists in the bloodstream. And so the way that we measure that is a unit called micrograms per deciliter, kind of a mouthful. But let's say you increase the blood lead level in a young person from 5 micrograms per deciliter to 15. We actually see a doubling in the reduction of IQ points. So they went from reducing their IQ 1.6 points with the 5 micrograms per deciliter to a 3.22 point reduction by just that small increase. So we know that it's really important to reduce all lead exposure sources, and water is one of them, but we know that that lead, and if you all have been tuning into these awesome live streams this week, there's lots of different sources of lead, including paint and soil, but we really want to reduce that in terms of trying to prevent some of these serious outcomes for young people and then into adulthood.
All right, thank you. Now, I believe you mentioned the year that this will all take effect, that this testing needs to get started. What was that year again?
So by 2026.
2026. So keep that year in mind, folks. All right. So what schools specifically are affected by this bill in Washington State? Is it all public K through 12? Does it affect private schools at all?
Mm-hmm. And just, Alex, one other thing I'll mention about the last question
Sure.
in terms of the year. So the Department of Health, so this bill is already in effect, which is great. And the Department of Health is going to test around 400 schools per year, and that will help get them to that. By 2026, we'll have been able to test all of them because they had been testing previously through a voluntary program. But in terms of your question about which schools are affected, so this is all public, elementary, secondary, charter, and charter schools, and also the state school for the blind and state school for the deaf. And it also allows for state tribal compact schools to opt in, which is great. So we really cover a wide range. It doesn't include child care centers. And that is actually something that Representative Paulette is considering for the future is, we know that the youngest kids are most susceptible to lead poisoning. So that is a really important segment, but there's no kind of governing body or way of organizing child care centers. So it's a lot harder in terms of advocacy and moving legislation. It's a lot more difficult because we have OSPI, we have this state agency that is able to oversee public schools. But that's definitely an opportunity for legislation in the future.
Awesome. Thank you for walking us through that. Now, folks, we've got just a couple more minutes left on in our time today. And Kira, thank you so much for carving time out of your busy schedule today. And I just want to give you the opportunity and ask if there's anything else you'd like to add before we kind of wrap things up for the day.
Sure. Yeah. Thanks, Alex, for this opportunity. I would add that lead is an equity issue. So we know that older school buildings that have older pipes and fixtures are more likely to have lead contamination, and students with lower socioeconomic status are more likely to be in those older school buildings. So that's an economic justice issue right there. We also know that Black and brown youth are more likely to experience lead poisoning. And part of this has to do with multiple sources of exposure in terms of paint at home or soil near play areas. And it's important that we don't just talk about the health disparities of who gets lead poisoning and who doesn't, but to really identify what are the systemic reasons behind the inequities. So how did infrastructure get developed in our state in terms of housing and schools, and which kind of people were pushed to certain neighborhoods or redlined to certain neighborhoods, and how have these infrastructure inequity issues led to the health disparities? And so when we are tackling lead poisoning, we also need to tackle racism. We need to tackle institutional racism that is really the main culprit that has led to these disparities. So that's something important to consider, both the science and medicine of how lead shows up and affects the body, but also thinking about the larger societal forces.
Absolutely. I'm so appreciative that you took the time to kind of bring those equity points up. And the other day for a different presentation, I was looking at a map of lead and arsenic levels in the soil next to a map that looked at poverty levels. And they are almost identical in how they overlap. So I think it's always really critical to keep that in mind, that issues of public health, and more specifically here, issues of lead poisoning, are absolutely issues of equity. So thank you for walking us through that. So folks, we're at the end of our time today. And in addition to the efforts of the state to help ensure safe drinking water for children in schools, there are some steps that you individually can take to protect yourself, to protect your family from lead poisoning. And the first, arguably most important step that you can take as an individual is to make sure that all the children in your household, and honestly all the adults in your household, have had a blood lead level test, because that right there is the one for sure method to gauge if there's been any exposure to lead. And if there is an elevated level, that will allow folks to kind of figure out what the sources might be and to take appropriate preventative action. So that's the end of our time today. Please check out the Poison Center's Facebook, Public Health Seattle King Counties, the Hazardous Waste Management Team, all these sites. We're doing a lot of work together over this week to share out other posts, other videos, and other streams. And please share this stream out with anyone you think might benefit from it, which really is everyone. So thank you all so much. Kira, I can't thank you enough for joining us today. And I hope you are all well. Stay safe and healthy. Take care, everyone.